Dr. Megan McClelland is the Catherine Smith Professor of Healthy Children and Families at Oregon State University, where she serves as an Endowed Director at the Hallie Center for Healthy Children and Families. Her recent work has examined links between self-regulation and long-term outcomes from early childhood to adulthood. Recent advances in measuring self-regulation and intervention efforts to improve these skills in young children. She works with colleagues and collaborators around the world and is currently involved with a number of national and international projects to develop measures of self-regulation and improve school success in young children. Dr. Megan MacDonald is a professor of kinesiology, the Early Childhood Research Core Director at the Hallie Center for Children and Families, and the OSU IMPACT for Life faculty scholar, all housed within the College of Health at Oregon State. Her vision is that every child is active and accepted. These webinars are made possible thanks to generous donor support. If you'd like to contribute, please visit our website at autism.org. And now I will turn this over to our speakers.
Hello, good morning. You get the Megan and Megan show this morning or this afternoon, depending on where you are. My name is Megan McClelland, and I have the great pleasure of being here with my friend and colleague, Megan MacDonald. Not only are we great colleagues who work together, but we also are friends and almost have the same name. So, and we have different areas of expertise, which is very fun when we get to work together. So I'm wondering if it would be great to fill out the poll. I think we were curious about who is attending today. And so if there's an opportunity to be able to fill that out, we'd love to hear it. And our webinar will go for about 45 or 50 minutes, and then we'll have some questions. So great to see everyone here. Well, I can't see everyone, but great to see that you're all here. We're both at Oregon State, as Denise said, and without further ado, we're going to talk today about the development and co-development of early motor skills and executive function in children with autism. So, first of all, a quick overview of our talk today. We're going to talk, I will start us off and then turn it over to Megan MacDonald. We'll talk about the definition and importance of executive function and motor skills for healthy development in children. We'll talk about children with ASD. Then we're going to link those things together. We're going to talk about executive function and motor skills in children with autism, and then how relations may differ for children in different cultural contexts. Okay, let me first contextualize the talk a little bit and we're going to talk about executive function, motor skills, especially with children that have ASD. When I think about, and my area of work really is on areas of executive function and self-regulation. And so I just think it's important to orient us a little bit around definitions first. So executive function really are cognitive skills. They're really these cognitive processes of being able to have attention, working memory, and inhibitory control or self-control. Those cognitive processes really develop in the prefrontal cortex of your brain, as you might already know. They lay the foundation for what we call self-regulation, which is a broader umbrella of self-regulated ways that we think, learn, listen, and focus. So if you think about self-regulation, it's a broader umbrella that's really the conscious control of our thoughts, feelings, and behavior. And a lot of the work that we have done has focused on how these sorts of cognitive skills or cognitive processes then help children, especially in school or social settings, control their thoughts, feelings, and behaviors. And in fact, we wrote a book, a colleague and I, that actually gets at it in a nutshell. And the title is Stop, Think, Act, which is really what self-regulation and executive function skills are all about. Can you stop? Can you think? And then before you do something. Those are very challenging for any child and sometimes many adults, but it's really helpful, and they're also quite malleable, so there's lots we can do. We care about these skills because executive function, these kinds of self-regulatory skills, have emerged as a pretty important predictor for a variety of short and long-term outcomes, including things like, they're not everything, but they do seem to be important for a lot of outcomes, like social competence or social skills in young kids, how well you get along with other kids, how well you can interact and have interpersonal skills. things like your short and long-term academic success. So in one study that we did, we found that children with strong attention and persistence, as rated by their parents, actually had nearly 50% greater odds of finishing college by the time they were 25, which was quite shocking in a way to us because we actually took into account children's reading and math skills when they were 8, 12, 16, and 21. So the thing that was the biggest predictor of whether they finished university by the time they were 25 was actually their attention and persistence when they were 4. So we thought, wow, there's something going on about these skills that seem to be important. Other people have also found there's links between these kinds of cognitive skills and long-term physical and mental health and development, educational outcomes, as I mentioned, wages, and employment. So let me turn it over now to Megan MacDonald. I'm going to come back in, but it's her turn now. Take it away.
Thanks, Megan. Really pleased to be here today and to answer questions later. And firstly, thanks for having us, since this is the first time I've had a chance to say anything. So Megan shared a little bit about the definition of executive function, but I'm going to talk a little bit about the motor skills piece of it, and then we'll kind of come back together. So for both, as Megan mentioned, for executive function and motor skills, they're really foundational for learning. So when we think about really young children, some of the first aspects of learning that we start to see or recognize are kind of based on their motor skills, learning to walk, learning to sit up, reflexes that we see, pulling themselves to stand. And so they're important for not only children's physical development, but also for their overall development as well. And those things go together. So gross motor skills, these are like jumping, walking, running, hopping, skipping, leaping. These are the big movements that we do. Lifting and throwing as well. And they're tasks that we do in everyday life. So they're tasks that we likely all participate in one way or another. And there's a metaphor when we talk about motor development, there's a metaphor that there's a mountain of motor development. All periods of motor development are really important for development, but we really build upon these skills too. So as we start to learn skills, they start to become more proficient, we start to coordinate them better, and they start to become more refined. And for gross motor skills, including skills like sports-specific skills, we start to see that the foundation is there, a strong foundation between the chronological ages of 7 and 11 years old. So children typically within that age range are starting to really have that core foundation of their gross motor skills. Fine motor skills are more refined and precise. So those are things like handwriting, buttoning our shirts, drawing, and also things like visual motor integration. So they involve coordinating visual perceptions with motor movements, and things like copying geometric shapes, coloring within the lines. Those are all things that require more fine motor skills. So we know already from some of the work that's been conducted with some of our colleagues and with Megan, who's on here too, and myself with some of our other work, is that visual motor integration is linked with children's school success, such as literacy and mathematics. Okay. I also before I go into the next slide, I also just wanted to share too, and I'm going to come back to this later. I think that when we talk about motor skills and we think about a child's social world, it's often in their school or in some aspect of their community or their home. And gross motor skills are really important for some of the games and activities that children play that are part of that social world too. So consider some common schoolyard activities or games that you might see, or some sports specific skills that might be important for the families that you're working with, for yourself, and how we kind of interact with those activities too. So this likely isn't a group that I need to go into too much detail on the slide that's here, but we do want to share that I think everyone's familiar with, that currently the estimates of autism in children are 1 in 36. We know that's about 1 in 45 for adults. Boys are 4 times more likely to be diagnosed with autism spectrum disorder compared to girls. And more recently, in 2022, we did see a revision to the Diagnostics and Statistics Manual, the 5th edition, now the 5th TR edition. But generally speaking, we know that autism characteristics include challenges with social communication and interaction skills, and also restricted and repetitive behaviors. Okay, we can go to the next slide. All right, so I did want to orient everyone a little bit to what we actually know about autism and motor skills. And I think sometimes we forget that what we just talked about with the common characteristics associated with autism, if we go back to some of the really early descriptions of autism, including those that came from Asperger and from Kanner, we actually see clumsiness as sort of a descriptor that came up. And then it's there, and then it just kind of fades away for a little while. It's not necessarily something that's talked about as much in some of the literature that we review over time, but it's gaining more attention these days. So here are some other things, though. In really young children, we do tend to see delays in motor milestones compared to their peers without autism spectrum disorder. So those are things like rolling over. With some groups in the US, we're also seeing delays in head lag. And more generally, parents or caregivers of children with autism spectrum disorder start to see delays sometime between 14 and 24 months old. So if you put that in perspective, a child usually walks around 1 year old. And once they're 1, they're really starting to develop some of those motor skills. We also know, and this is something that's ongoing with research as well, that there's a real possibility that some motor skills specifically could be potential diagnostic markers or really early indicators that would likely lead to different screening mechanisms. In school-aged children, we know that motor skills are qualitatively different. So if we think back to that description that I talked about that mountain of motor development where we have, reflexive skills at the bottom and fundamental motor skills at the top, or sports-specific skills as we're starting to become more proficient at something, we're really building upon those skills that we have. And that's between the ages of 7 and 11 years old. That's when we kind of have that core foundation of gross motor and fine motor skills that we're building upon. So for school-age children, that's a really important period. 7 to 8 might be playing basketball, schoolyard games and activities, playing with friends, making up games that require some aspect of fundamental motor skills too. But what we also know is that for children with autism, they're often able to perform the skills, but they're qualitatively different. And I'll come back to this in a second and explain sort of where that links to some chronological age pieces. Megan, we can go to the next slide. Okay, so this is some work that I did about a decade ago with some colleagues, and this is really specifically looking at very young children with autism spectrum disorder. So it was a data set that we had access to. All of the children in this particular study were diagnosed with autism, and we were able to retrospectively go back and really look at their gross motor skills. So what you're seeing on this graph is deficits. And at the very bottom, you'll see 3 little white boxes. One says 12 to 24 months, one says 24 to 30 months, and one says 31 to 36 months. So these children are between 1 and 3 years old. So ultimately what happened when we looked at their gross motor skills at between 1 and 2 years old, children were about 3 months behind where they should be. So, okay, 3 months behind, that's a delay or something that we might notice. Between 2 and 2.5 years old, we saw that children were about 4 months behind where they should be. Similarly, that's a delay. But then between 31 and 36 months old, so between 2.5 and 3 years old, we actually saw that children were about 9 months behind where we would expect them to be in their gross motor development. So again, starting to look at some of those qualitative differences that we see, but now we're talking about a 3-year-old child who's closer to 1 year behind where they should be in this development. And so those are areas and opportunities where we might intervene on this. Megan, you can go to the next slide. So the previous slide was gross motor skills. So these are things like walking, running, throwing, and coordinating a lot of those movements. Fine motor skills, which again are the more precise movements like handwriting. We did the same study and looked at fine motor age difference scores. And what we saw was between 1 and 2-year-olds, children were about 4 months behind where they should be, or expected to be, I should say. Between 2 and 2.5 years old, we saw that children were about 8 months behind where they were expected to be. So again, we're pushing that 1-year mark. And at 3 years old, or 2.5 to 3 years old, we saw that children are actually a little bit more than a year behind where we would expect them to be. So again, really early on, we're starting to recognize that both gross and fine motor skills are delayed. Megan, you can go to the next slide. So that particular study was with really young children. So starting to see these delays early, we were looking at a group of children between 1 and 3 years old. Our colleagues at another institution had an earlier study where they were really interested in the fundamental motor skills of school-age children. And what they actually found in this particular study was that children who were between 10 and 12 years old were chronologically about half their age when it came to motor skill development. So a 10 or 12-year-old, we're talking about motor skills that look more like a 5-year-old or a 6-year-old. So just think about that for a second and what that might look like. So a 10 to 12-year-old, if you're thinking about maybe playing basketball on the playground, soccer, some of the activities and games that friends might want to play, there's a lot of coordination, there's a lot of activity, there's a lot of fun that's included in that as well. So now if you're thinking about a 5 or 6-year-old, we're talking about very qualitatively different fundamental motor skills. All right, let's go to the next slide, Megan. Okay, so before we move on though, I do want to share some good news. So ultimately we know that motor skill delays exist, and we have empirical research that shows this, but we also have empirical research that shows that motor skills are malleable. These are skills that we can teach. These are skills that can be improved. And with practice, sometimes adaptive equipment, these are areas that where we can get children to where they need to be for their daily living skills. Okay, Megan, I'm going to pass it back to you.
Awesome, thanks. So on that same note, I just want to add in addition to the motor skill information that Megan was just talking about, we also know that there's a lot of research to show that executive function in children that are developing, and especially those that are experiencing risk factors of, lots of different ways we can define that, but that executive function can also be an important protective factor or buffer, simply because of the exact same thing that Megan just said. These skills are highly malleable. There's a lot we can do to improve both executive function and motor skill development. And so I think that's really an important message to take away. This is important because we do find that executive function deficits have been shown in areas of planning, that we were talking about, inhibition or self-control and self-monitoring. So all these pieces, those cognitive processes we were talking about that have to do with executive function, those are pronounced. There's more deficits in those areas for children with autism. And the next one, I'm just going to also kind of start connecting these constructs, because what we also have found a lot of evidence for ourselves and with others is that executive function and motor skills may really co-develop in children. And we know this because they align with brain development in young kids. They, as you are developing, especially these conscious control of your thoughts, feelings, and behaviors, that also aligns with your motor skill development around fine and gross motors. So we know this. There's some brain, I just talked about brain areas involved in motor activity that are also involved in the aspects, the parts of the brain that are involved in your executive function development. And so I think it's really useful to see how these kind of align and they co-develop, especially in young children, as the brain starts to, differentiate and get more specific in its functioning in the first 5 years of life or so, and further than that. what we know, there's some interesting findings that the parts of EF that we're talking about, the memory, the self-control, are related to fine motor skills. So that was an interesting thing. We started finding some interesting differences in how parts of executive function were related more to fine motor skills, and then versus gross motor skills. Even though executive function and fine motor skills are related to each other, we also have evidence that they're not the same. They are differentiated. So what we're starting to see over time, and this also aligns with work out there in the field that you all are doing perhaps, or you've been interacting, is that you see these things go together and that they're interrelated. So I think this is for you, Megan. You're going to take it on, connect that one.
Thank you. So to really summarize some of before we talk about some of the studies that we've done, traditionally, executive function and motor skills have often been studied independently. So one construct is studied and then another construct is studied. Megan and I have been working together now for about 13 years. And as you can probably tell from this talk, I'm coming at things often from the motor skills side of things. As a professor of kinesiology, and Megan is an expert in executive function and school readiness, and really coming at things from the cognitive side of things. So we've been able to really work together to say, hey, sometimes I think we're talking about the same thing, but let's learn about this and let's kind of work together to figure this out. So, and we've also had many students that have helped us out along the way. So I just want to put that out there so that we don't forget that they have done a lot of this work for us too. So generally speaking, there's really a paucity of empirical work in this area, specifically in children with autism, that's looking at relationships between executive function and motor skills. So there's a paucity of research in general, and then there's even less work in respect to this specific population. So we do know, though, in some of the work that has been done, that fine motor skills and balance were significantly correlated with cognitive flexibility among school-age children with autism spectrum disorder. And until recently, this work has also primarily been conducted in Western countries. So a lot of what we do know about autism and executive function and those relationships where we continue to see aspects of positive relations, majority of that has happened in North America or other Western countries. We can go to the next slide, Megan. So one of our students who's now graduated was really interested in both of these constructs and also how they might differ in one way or another, based on, we know that both executive function and motor skills can be impacted by various aspects of cultural context. So, for example, for motor skills in particular, research has shown that Chinese children exhibit better fine motor skill performance, while American children demonstrate better object control skills. And so if we think about some of the cultural context that's associated with that, we know that in some Eastern countries, folks are using different tools for meals. There are different aspects of fine motor skills that might be used in daily life. In American children, we know that there's sort of a lot of early sport introduction, that's highly valued when students go to school, playing on teams. So that cultural context might play into some of these pieces too. And also, when the gross motor skills of preschool children in Hong Kong were compared to American children's performance scores were significantly lower. So we sort of see in some ways, and it's a broad statement, but a lot of value placed on gross motor skills from a cultural context in Western countries, and maybe more value or placed on fine motor skills in some Eastern countries. So we're starting to see this difference in this development for some of these children. Okay, we can go to the next slide, Megan. So because of this, we conducted a study that was really looking at executive function and motor skills in children with autism spectrum disorder in Taiwan and the United States. So the purpose of this study was to examine the relationship between parent ratings of motor skills and executive function in children with autism in both the United States and Taiwan. So taking into consideration those primary constructs that we're interested in, this relationship between motor skills and cognitive skills or executive function in this case, and also like, does this exist? The same relationship exists in different countries. And also, are there differences in how this relationship exists between these two countries in this particular study? Megan, we can go to the next slide. So this was a survey, and we had 172 parents or legal guardians, caregivers of children who were between the ages of 4 and 6 years old. These were parents of children with autism who were recruited from 2 different countries. About 100 of these children were from Taiwan, and then 72 children were from the United States. Okay, we can go to the next slide. And this was a comprehensive survey that the caregivers filled out. So we were interested in a lot of things, and there were a lot of things that we wanted to consider as we were looking at these relationships. So we were able to collect demographic information on the families as well as the children. These are young children. So again, we're talking about the development of executive function and the development of motor skills as we're looking at that particular age range of children between 4 and 6 years old. And the parents filled out a specific assessment of motor skills and a specific assessment of executive function. And not surprisingly, these surveys were in 2 languages. One survey, they were in 2 languages for the 2 different countries. And the student who was working on this project was able to do some of that translation for us as well. And then there were just a series of statistical analysis that we did to really determine whether or not these relationships existed. Megan, we can go to the next slide. So ultimately, the results found that motor skills were associated with executive function as rated by parents in both countries. And we can actually go to the next slide, Megan. And so this was really interesting because we found that it didn't depend on the country. So even though we see some of these differences that we assume are based on cultural context with motor skill development, both gross motor and fine motor, that differentiate a little bit between the 2 countries, this relationship still existed regardless of which country the children lived in. The relationships were culturally comparable with significant and positive correlations of magnitude in both countries. And then also, this was really interesting for us because no research to date, to our knowledge, has explored this link between these 2 constructs and these children cross-culturally. Okay, we can go to the next slide. So in conclusion, we have executive function and motor skills are foundational skills that contribute to school success and healthy development for children from diverse backgrounds. And that although we know that there are delays or deficits in executive function or cognitive skills, executive function and motor skills in children with autism, these are malleable skills, as we talked about, and they can really be improved with intervention and practice. And also, I think in all of those cases, often, in some cases, individualized instruction, adaptive equipment, and sometimes additional time in working on these skills as well. And then our research found that relations between motor skills and executive function for children with autism did not differ between children in the US and Taiwan. And so, of course, there are always limitations to every study. So the sample size, there's a lot more work that needs to be done in this area, but also some initial early indicators that we do continue to see these relationships between motor skills and executive function. And as we've shared, because both of these skills are malleable, we're also really interested in like how improvement in one might have improvements in the other. But that's work that's ongoing that we're still learning a lot about. So we want to acknowledge, first of all of the families and participants that have participated in all of our studies that we've mentioned today. Also our funding agency, and in this case, a particular award that was granted to Dr. McClelland, and also all of our collaborators on these studies too. So we've mentioned some, but there are many others as well that continue to contribute to the work that we do and the teams that we work in. And I think that we have plenty of time for questions. So thank you for your attention. And we have already seen that there are a number of questions that have come up in the chat. So I think Megan and I will take a quick look at these.
I can jump in if you want it. We can tag team, but thank you, everyone. Thanks, Megan. That was great. And this is like the best part of the talk, in my opinion, because then we get to have a little bit more back and forth or question, just discussion maybe, right? About things that you care about. So maybe if it's okay, I'll start with the first question on the list. Is that okay? The impact of COVID on EF for this population. So someone asked, what's the impact of COVID on executive function for this population, especially for children who are 4 and 5 during the pandemic? Yes, I know a lot about this. Attention and persistence were significantly affected for all children during the pandemic, but for these children, do you think their academic success will continue to be impacted into adulthood? The $1,000,000 question that we're all, if you work with kids or you have kids, holy moly, yes, this is a big one. And then Megan, if you wanted to, do you want to jump in for any reason? Yeah.
Well, I think this one's specific to executive function. I'll also share that during the pandemic, similarly, we know that there were a lot of things changed. We didn't necessarily have access to things that we typically have access to. But I will also say that one of the things that we've persistently kind of talked about is that these skills are malleable. So there's kind of this idea that with catch up and with intervention and with practice and commitment to sort of working on these skills, that they're malleable and change. And so I think that there's lots of opportunity to work on that.
I'll add that, yes, I think COVID did impact kids' executive function skills across the board. We know that kids, there's lots of variability. If you were, we know that kids who had more resources or supports fared better. We know that kids with ASD may have also, I think it varied a lot, but if anybody who's growing up in the context of risk, however we want to talk about risk, sociodemographic risk, historically marginalized populations, when we think about that, they struggle to get supports that they need and the opportunities perhaps to practice these skills. We really saw that across the board during the pandemic. But I would just echo what Megan said, especially early on, but there are these windows of opportunity, I like to call them, the early child years, the transition to adolescence, the transition to adulthood years, where there's a lot of brain development going on. Those are opportunities for throughout early childhood and into adulthood where kids can be practicing these skills in ways. And some of the other questions asked about how to practice, so I can jump back into more specifics in a second. Megan, do you want to pick one to answer? I can do the next one, or you can.
Sure. I'm going to skip to what I see as the third. I'm not sure everyone else has the same access that we do. Yeah. So the third one, I'm going to paraphrase a little bit, but I believe that this is a caregiver who's acknowledged that their child has just been diagnosed with autism. And what I glean from this is like that there are a lot of opportunities to do a lot of different things, including maybe working on executive function skills and motor skills and physical therapy and school interventions. And as well as like academic skills like reading and writing. And what I'm taking away from this is how the comment in here is, how do you handle all of this? And that's a great question. And so I would really encourage you to talk to the providers that you're working with your school and one piece of it at a time. So I think that one of the things that I have always appreciated about motor skill development and learning, and keep in mind, this is my area of expertise and interest, it's fun. It's something that we can all work on in a time. It's playing with kids. it's going on a family walk together, it's climbing gym equipment, it's practicing a sport or activity. And so I think, in my opinion, sometimes when some of all of those services and all of the things that have to happen are overwhelming, it's also okay to take it's okay to take a break and to do other things that are a part of your daily life. But also remember that not all interventions or work have to be intensive, to the sense they should be fun for the family and for your child as well. And there are other resources as well that are available that we might be able to link to kind of talk through how to prioritize. But I would encourage you to talk to your providers about that.
Someone asked about how retained primitive reflexes affect motor and cognitive development, how it affects executive functioning. Additionally, which providers would be ideal to refer individuals with suspected retained primitive reflexes for further evaluation? Oh, it's a mouthful. Okay, so that what comes up for me here is brain development. So a lot of times what we know is when you have reflexes that persist, that should be replaced by, conscious control. In infants in particular, we note this and we wonder also how it's related to brain development. And that is related also to their motor and cognitive development. And all of this goes together. So a lot of this wraps up in the developing brain in the first 3-5 years of life. Those things, the reflexes, are supposed to be replaced by more conscious control of motor skills and behavior. Eventually, the executive function, you don't expect a 3-year-old, please, by the way, to be able to plan and organize. I mean, when I ask a child a question, sometimes before, I'll say, what do you think about this? It's more an executive functioning task. And sometimes I get an answer. And sometimes I get somebody who says, I have a pet turtle. Do you want to know about my pet turtle? And so that's pretty typical and it's normal. And so I think we have to also understand there's lots of normative development going on. And so that can make it challenging to identify when there might be delays and it might take a bit. So I would normally always, as Megan said, go to your primary care provider to talk about potential delays, especially around if you're continuing to see reflexes show up and how it does affect their eventual ability to, again, think about what you're really talking about here is moving from those primitive reflexes that are involuntary to more conscious control of your behavior, your thoughts, and your feelings. All that develops very gradually. But when you're not seeing some of that, that's when you want to go and talk to your primary care, watch it, get diagnosed, get referred for further evaluation, probably to a neuropsychologist, but I'm not the expert on saying that for sure. Do you want me to talk about motor skills training affecting EF or?
Sure, happy here. We both can.
Yeah, I'll start.
Yeah. Okay.
I'll start and then you take it away. Yeah, this is certainly stuff that we care a lot about. We're both very experienced in some of this work, but one of the things I'll say is, yes, especially like I know some interventions that are programs that focus on helping kids do fine motor practice, motor skills training, more of that visual motor integration that has been shown to improve their ability to focus, obviously, right? When you have like small little things you have to focus on practicing, that can help your ability to plan and focus your attention. There's more, and there's also some evidence. You want to talk about the gross?
Yeah, I think there's still a lot that we need to get at in terms of like what's predictive of it and like how it all kind of works together. But the fact that we're seeing relationships, and also we know that some of these activities commingle with how we're looking at them too. So I think in this example, you say, for example, my child seems to be typically developing for motor development, but it has challenges in the executive functioning realm. And so I think that there's ways to work with that from an intervention perspective too, right? If you're doing activities or games together, there's ways to kind of engage in some aspects of executive functioning, like a freeze tag. So let's freeze and wait. Right? That's working on aspects of executive functioning skills. So there are ways to kind of play with some of the strengths that you see in your child to work on some of these other activities.
Yeah, there's another question. I'm kind of jumping around a little bit, some tactics to improve it. And I might just add, since we're on this topic, that the ways that you can improve these skills, especially in EF, really differs by the age group. We have an intervention program that's called Red Light, Purple Light, and it's a series of music and movement games that are gross motor, actually, but are played in preschool settings. And they help kids stop and think and then do something. So there's definitely gross motor skills there. There's links to fine motor skills. If you can give kids opportunities to practice games that make them stop and think and then maybe do the opposite, something different than what they'd expect. So dance fast to fast music and slow to slow music and then freeze. And then guess what? When the fast music comes on, I want you to dance slow. And when the slow music comes on, I want you to dance fast. So you're doing something different than what you would normally do. So when you add in new rules like that, kids really have to stop and think. Now, the question that I'm looking at was about a teenager, right, who can't use calendar or plan work. So that's different. I don't know that a teenager is going to want to do stop and freeze, maybe, but my teenager wouldn't. But one potential, what we do there is there's a lot of interesting work on setting goals and having very identifiable goals with reinforcements built in. And so you monitor, they call it progress monitoring. And so they set a little goal, and we do this ourselves. I'm going to work this much, and then I'm going to reward myself by getting a coffee. I'm going to walk around the building. And so there's these small little achievable goals, and you start kind of working on your planning because you have, okay, what am I going to try and get done? Even small things like this afternoon, like this one assignment I have to do. And a lot of times it's really starting very small. There's also activities that require focus and discipline. I'm thinking of things like martial arts, dance, specific gymnastics, any kind of exercise that's complex that you really have to be focused and disciplined. They actually have been also shown to improve executive function. Do you want to add anything, Megan?
Not necessarily. Sorry, I'm just looking at some of these questions too.
There's a lot, so I'm trying to.
There are a lot. Yeah. I might skip to a different question from our study. So we had a question about how we recruited and how severe was the autism in the particular study that I discussed. So discussed a few studies, but the main study where we looked at autism in both children from the US and then children from Taiwan, we did not have any clinical diagnosis as a part of that survey. So it was self-report from the parents. And I believe we used a proxy about whether or not they were obtaining additional services elsewhere. So we didn't have a specific severity measure of ASD in that study. In the earlier studies that I was talking about, looking that showed fine motor deficits and gross motor deficits. So we saw fine motor deficits really early on in children that were 1 to 3 years old, and then gross motor deficits in the same group of children at the same age. We did control in that study for cognition. We had an IQ, we had access to IQ in that particular study. So it was independent. So those motor skill deficits were independent from cognitive skills.
Let me think, other questions? I know there's like 27 questions, so I'm trying to. I mean, I don't know if you want to speak to the one about African countries accepting autism as a form of cultural discrimination. Many parents who have children on the spectrum hide them, which is common. And we see them not just there, but I remember working with a colleague in Taiwan and using this measure called the Ages and Stages, which is a screener, and definitely seeing the same exact issues there. How have you been able to prompt early screening with high rates of cultural beliefs against autism? Do you want to talk about that, Megan? Do you
Yeah, so I have done a little bit of work more generally in one African country, in Botswana, with people with disabilities. That those studies and that work is ongoing. And so some of what you're sharing here is reflective of that. I will share that from what I've been able to see in Botswana, there is really integration into the school system, and also special education units. Um, so, I think that, and I think in this particular community where I've been, there have been a lot of workshops around more generally like disability awareness and learning more from both a health, education, and community perspective. But I'll also say that a lot of those cultural beliefs kind of take time, and community and the people around you and those support mechanisms. So how have you been able to prompt early screening? Uh, so again, I think talking to your providers about some of the signs or symptoms that you're seeing with your child and having really candid discussions with them. That's my recommendation.
And I think that researchers can do a lot to sort of normalize and talk about strengths, the great strengths these kids have also. I mean, there are incredible strengths that they bring in terms of focus in some, and so I think being able to normalize some of the conversations. I remember the researcher I worked with in Taiwan a long time ago now, sort of just using this measure, this ages and stages measure as a way, because it was a little bit more broad and it was a little bit less, I think, sensitive. It was sort of a, overall picture, and it was a way to ease into the conversation of just how kids develop. And there's lots of normal development, and then there are kids that are really struggling, and this is what to do, right? When these screeners pick up these delays.
Yeah.
Can I talk? Do you want to say something else?
Oh, I was going to jump into the question, so you go ahead.
No, I was going to jump to the one about EF coaches because that's fascinating, but you want to go to you take the next one.
Okay. Well, I think actually the one I was looking at was right under that. And it was sort of this recommendation of a self-regulation program for children with autism and youth. And I think we've shared some already, and Megan shared some of the interventions that she's studying around self-regulation or executive function right now. But I would also really suggest start, your kid best, your children, your people, and your community's best in starting where they're at in respect to these things too. So with the example earlier where there was a child who was really proficient in motor skill development, or if that's something that they like, it's a great place to start. And then playing together, being together, and using some of these changes and rules that Megan was talking about. And it's going to be a little bit different for everyone.
Yeah. And that gets to this question about EF coaches. Fascinating. I haven't even heard about this, but boy, I should change fields and look at us. We could really make a lot of money here. The question is, I've heard about EF coaches. Do they really exist? I have no idea, but oh my gosh, if you're mentioning this, maybe they do. If yes, what is their role? Is it in school or outside? I'm especially asking for a rising middle schooler. Well, okay, perhaps I can't speak to whether I know whether they exist, but I think just like they have parenting coaches and they have tutors, I would not be at all surprised if now they have EF coaches. Here's what I would say. I think there is so much that you can do. I mean, certainly given your own situation, you can figure out, you can decide for yourself if you need to find someone. But I would want to know about what kind of qualifications do they have? I mean, it's sort of like, do they have graduate study training, in executive function or something like this? For me, I think there's so much that you can do to do this just a little bit more intentionally and that can really be feasible and embedded into your daily life, honestly. So speaking as a parent here, I think there's a lot we can do to just help kids be planful, work on talking about being planful ourselves, helping them get involved in activities that require discipline and focus that they are interested in, so that require these kinds of planning and executive function skills. So for, those things like I mentioned, some martial arts that require lots of focus and persistence, dance and gymnastics, that are not just like, routine kind of running, but they actually require a lot of focus and persistence. And not that running doesn't, but those kinds of sports can be actually quite useful. The other thing I would say is routines are hugely important. And so the more that you can help your child get into planning it out, I often say to my kids, I'm sure they're so sick of it, like, okay, tell me your plan. What's your plan for this? And I'll say, okay, here's our plan. Because for us as a family, we have these routines that we embed as part of, we try to stick to those. And so the more you can have the consistency and some intentionality around talking about, here's going to be our plan. We're going to do this, then we're going to do this, then we're going to do that. And as you start scaffolding those skills in just the way that you talk, it helps your own organization, I just would like to say, and it can help your kids be a little bit more cognizant of the importance of those things. But everyone is in a different situation. I would just, if you're going to look into an EF coach, I would want to know like what kind of training they have there.
Yeah. The question close to that, I thought, but there's one here that says, do you have any data at what age children catch up with their non-autistic peers when it comes to finding gross motor skills? And so my short answer is no, we don't have data that suggests when they catch up. The longer answer is that we do know that there are major improvements with interventions. So I have a few studies that have clearly identified this. So one of the ones that had a lot of attention about a decade ago and still sort of lingers out there in the field is teaching children with autism how to ride a two-wheeled bicycle. So in the US, 10 years ago, it was more of a rite of passage. There's lots of different wheels now, like rollerblades and scooters and things that have changed a little bit. But, we know that that's a really important skill for independence and for movement. And we also know that for a majority of children, it's around 7 years old when they generally become proficient at riding a two-wheeled bicycle. We also know that for many children with autism, that's a skill that's more difficult to accomplish. So one of the studies that we were able to do was actually an intervention to teach children how to ride a two-wheeled bicycle. And there was a lot of time on task. So in this particular repetitive motion, we were looking at time on task. So in this case, we did 75 minutes a day for 5 days. And we really broke down those skills too. So if you think about riding a bike, it's not just pedaling and staying balanced. It's also getting on the bike, knowing when to stop the bike, braking, starting, like how do you get started on the bike and all of these things. So the first thing that we taught was just riding. Don't worry about setting the bike up. Don't worry about getting started. There was a human resource that was available to kind of get things started. There was some adaptive equipment to get used to that balancing piece of it while the kids started to learn. And then once that skill was mastered, then we started teaching the other things, how to brake. And there are other things we can do with equipment that can be really helpful in building these skills. So when they were first learning, when we think about that coordination of riding a bike, in some cases, you're pedaling a bike and then to stop, you have to pedal backwards. That's actually more complicated motor coordination than if you're using different body parts. So it's actually easier to pedal a bike. And then when you want to stop, use the hand brakes to stop. So making sure that that equipment was available to initially sort of start to learn the skill. Anyway, we had, I forget the specific success rate, but it was in the 80 percentile. So majority of the children who partook in this intervention were successful in a short time frame of learning to ride a two-wheeled bike. So my short answer is don't know the age when they catch up, but the longer answer is with the right supports, there's opportunity for learning.
And just to add to that, I think some of these other questions have to do with like how behind are they going to be in adulthood and that sort of thing. And I think what's amazing to me is that there's something called that I teach. It's called this concept of relative plasticity. And we know that the brain, for example, continues to have lots of plasticity and malleability. This is the opportunity to change throughout our life. We do know that it's early on in life, it's the highest potential. There's the most it's the most, if you want to say plastic, right? There's most opportunity for change. And that as we get older in our life, there's less, but there's still opportunity for this plasticity. So when I say relative, what I mean is that it's within constraints. We're not all born as blank slates that you can just build a child. Wouldn't that be nice? No, what it is we come in with this collection of strengths and weaknesses, their characteristics, their ASD, there's all these things, and how far we can go, right? This is our plasticity continues to be there throughout our whole life, but it's going to be constrained by some limitations. We're not all going to, have the same kinds of things we'd all like to, have, obviously. I'm not going to be like Einstein. So, but I think that that's a useful framing of it, which is that there's plasticity and there's malleability and there's potential for change and improvement throughout our life. There are areas of the lifespan that are more open to that than others. And then we have these boundaries that we have to work within. And how can we help kids be at their potential with it, given all those things?